Sorry, class, I managed to cut myself off. All right, what is the therapeutic outcome of anti-Parkinson medication therapy? It is to decrease the symptoms of the disease. Which nursing intervention is best for patients with Parkinson's disease? 6 small meals per day rather than 3 large ones. You don't want to provide for all of their basic needs. You want them to still participate in their care. You don't want to schedule all their activities at the same time. That's going to wear them out if you breakfast, bathe, and do all the activities. And you don't want to stimulate them too much, although you do want to stimulate them some. All right, carbidopa and levodopa therapy, which is adrenergic therapy. Carbidopa and levodopa are given in combination. Carbidopa reduces the metabolism of levodopa, so more of the administered levodopa reaches the receptor sites. And levodopa is used to replace dopamine deficiency in Parkinson's. And the brand name is Sinemet or Parkopa. So your medication card that you're doing for me is Sinemet. Drug card. All right, common adverse effects: nausea and vomiting, orthostatic hypotension. Nausea and vomiting, orthostatic hypotension. I said that twice, didn't I? Okay, so we know from in the past, if your patient has orthostatic hypotension, that they're going to need to be very careful about rising slowly, preventing falls, not moving too quickly. It may be that they need to adjust when they take their medication, so if it causes this problem, because you don't want them to fall. Serious adverse effects are all of these things listed here: chewing motions, facial grimacing, rocking movements, etc. So if I ask what symptoms are reduced with an anticholinergic, it would be drooling and tremors. And you do want to take your levodopa with food and on a regular basis. I didn't have that on the slide, but the patient needs to try to take their medication at the same time every day. Be sure and read through your section in your pharmacology chapter on Parkinson's disease about levodopa administration, and look up what could cause a reduction in therapeutic effects. Okay, patient education for levodopa. All right, explain the many adverse effects, what we just went through. Most are dose-related and reversible. Expect orthostatic hypotension, we just talked about that, and monitor the blood pressure daily. So what is the action of carbidopa-levodopa? Provides increased amounts of dopamine to the brain. Okay, COMT inhibitors, Comtan, used to treat when carbidopa, levodopa become less effective and adverse effects develop. So if you start seeing the patient have some of the smacking and that sort of thing that we talked about, then this could be introduced as a therapy also. Common adverse effects: diarrhea, sedative effects, and a urine discoloration of brownish orange. Okay, monoamine oxidase B inhibitors. So MAO-B inhibitors. So we have a couple of different examples here: selegiline and rasagiline. And uses are when carbidopa-levodopa loses its effectiveness, And common adverse effects are constipation and upset stomach. And, well, I think it's on our next slide, actually. Okay, what aspect of selaglutine or aldopril therapy must patients be aware? High tyramine foods such as aged cheese and Chianti wine must be avoided. So there is a flag about if they're taking an MAOB inhibitor, it is a no-no for them to have aged cheese. Okay, anticholinergic agents, cogentin, reduces hyperstimulation caused by excessive acetylcholine, reduces the severity of tremors and drooling associated with Parkinson's. Common adverse effects, constipation, dryness of the mouth, throat, and nose, urinary retention, or blurred vision, because it is an anticholinergic, so that's what causes the constipation. Okay, and when we are looking at chapter 14, just a couple more things to point out here. I think I reviewed well what terms that you needed to review in your key terms section. So look through those that we talked about. Let's see, I think we well went over side effects that you needed to be aware of. Many of your nursing diagnoses will have to do with safety of your patient. Remember, we're not going to be concerned with dosages of our medications, but side effects mainly, and important things to remember for red flags in taking these medications that you want to watch for so that you do not harm your patient. Okay, thank you for your attention.